Okay.
Hi, I'm Kevin Johnson. I work in Delta, Colorado at a small hospital here. Well, it's a small town, so it's small. I've been here for 5 years and have been practicing as a physical therapist for 10 years. I worked in the Denver area and in Golden for a few years and went to school at the University of Colorado in Denver at Anschutz Medical Center. And I moved to Western Colorado. That's where I grew up. So I knew eventually I'd return here, and I've been loving it, and it's great. Currently, I am. I've worked in outpatient orthopedics mainly in my career, but I'm kind of shifting gears a little bit because I see a void in treatment of patients with chronic pain issues, and so I'm currently taking a course to specialize in chronic pain. So that's um, it's been a lot of fun so far.
Yeah, very interesting. Well, what have you really seen that has changed in your work life and what you're having to experience
I think probably the biggest changes that I've noticed are just the techniques that we're using or the means that we're using to keep things clean in our clinic, and to make sure that germs aren't being spread. And we got a new clinic director he's been here about 6 months. And when he came in, he actually made some adjustments on how we label things and make sure things are clean before this COVID-19 ever started. So it was almost like he had some foreknowledge
now?
of, oh no, something's
Great.
coming down the pipe. So we've definitely been trying to maintain the cleanliness in our clinic. We've been wearing masks with all of our patients, not right from the get-go because it wasn't required right at the beginning,
Mhm.
but ever since it was required, we've been doing that. And so we've been wearing masks. One of the challenges that we saw with that is that there weren't um, the N95 masks weren't available to us, and so I actually had a coworker that got a hold of a couple of those,
Okay.
and she gave me one of those, which was great. Um, but other than that, we've been really trying to take care of our patients and ourselves, and watch, if we're having any symptoms at all, like to stay home and not bring that sickness in at all. Um, I went on a vacation actually right before this where I traveled and landed in California a couple times, and so when we got back, we had had some symptoms that we had picked up from California, from the airport or on the plane or something. So um, I luckily had access and got tested and didn't have COVID-19. So, but I took those precautionary steps to not work those for about a week after I got back, just to make sure that everything was clear.
Yeah.
Um, Whereas usually I would probably come into work, if I just had a sniffle or a cough or a mild fever, not a big deal. Like I can work with that, but with COVID-19 being out there, I knew that wasn't a smart thing. So
Right.
yeah.
Right. Absolutely. That's interesting. How did the testing process go? Did it take a long time to get results?
It took no, it took about um, I think 6 days, 7 days to get
Okay.
that back. So right away they were able to swab and make sure that I didn't have the flu. They
Okay.
were able to do that, and so the flu was ruled out. But then they had to send on the testing somewhere else. We don't do the testing here.
Right. Right.
So
How has it impacted some of your practice and how many patients you're seeing? Are you still seeing the same amount?
oh no, yeah, we're way low on patients right now, and I'm lucky if I have a half day worth of work each day. So
Wow.
yeah, it's way down. I think people are just being cautious. They even though there's only been I think seven confirmed cases here of COVID-19. Patients they just don't want to chance it.
Right.
When we do have an elderly population here, so it's like, it's better safe than sorry, I think, is their mentality of it.
Mhm.
Um, one of the challenges with that is that I do have a lot of patients with chronic pain that I'm already seeing, and not being able to get out and be social is a huge issue when it comes, like, being social is very important when it comes to controlling pain. In that when patients isolate themselves, as they've been encouraged to do with this, it actually exacerbates their symptoms and can lead to worse flare-ups.
Right.
So that's been a big challenge for, I think, a lot of my patients that I would normally be seeing.
Right. Do you have you been doing like any, I know telehealth via physical therapy is pretty different, but have you guys explored that at all?
We have looked into that. I haven't personally done any of it yet, and it doesn't sound like, from things that I looked at through WebPT, a webinar that I had, it didn't sound like they were covering for telehealth through physical therapy yet.
Okay.
So that's, I think, one of the challenges of getting it up and going is that it hasn't been approved as that we were medical providers that could be doing telehealth yet. But hopefully things are changing. It sounds like things are changing daily, if not hourly, with a lot of the laws and stuff surrounding telehealth.
Right. Right. We were on a Monica and I were both on a call. I think it was last week that really talked about the economic impact this is actually going to have on outpatient services and the basic family practice doctors.
Yeah, yeah. And we're, I mean, even from that perspective, like, our referral sources are usually from the physicians, and so when they're not seeing patients, they're not referring patients, so it just keeps everything with the census really low.
Right.
Yeah.
Right. Absolutely. What do you think future of education and for physical therapists in school? What do you think you'll see in the long run?
Well, I'm not sure how much that's going to change, other than maybe a little bit more reinforcement of cleanliness and keeping clinics clean and making sure hands are washed in between each patient.
Mhm.
And just being very aware that when we do have any feeling of illness or anything, that it's okay to stay home. It's okay not to come. I mean, I have that challenge all the time where I'm like, well, I've got all these patients and I've got 4 new patients on my schedule today. I don't really feel like I can afford to stay home, because of that. Like, I don't want to have those patients rescheduled,
Right.
which puts a cramp on, my supporting staff here at the clinic. But I think it would be more likely that I don a mask, right? That I put on a mask and be more aware of that, which I probably haven't done as much as I could have in the past.
Right. Right. I mean, physical therapy, you gotta get close. You can't
Oh,
maintain
yeah,
that distance.
yeah,
So
for
that's
sure.
hard. Excellent. How is your clinic staff doing? Have you guys had to do any furloughs or letting people go?
We haven't had to let anybody go. We have been a low census at times, so if we don't have enough patients, then we're encouraged to go home. I mean, we've been doing some office or administrative work on the side that can also be done and needs to be caught up. We're actually switching EMR providers, so some of that training and that kind of stuff can go on now, which is really nice. Um, but they luckily haven't had to let anybody go. But I mean, if we don't have any work to do, yeah, we're going home.
Right.
So
Right.
that's been an interesting thing, because I have 4 kids at home, but just one of them is in school right now. She's 6, and it's been kind of nice to be able to go home and spend some time with the family.
Right. Right.
But, yeah, and luckily I have hours saved up so that it's not really affecting my pay right now. But the further it goes, the less of those hours I'll have saved up, and
Right.
so that could be a huge challenge.
Hmm.
Yeah.
Absolutely. what do you think is going to change? Like, how do you think this event will be memorialized in healthcare in the big scheme of things?
How do I think it'll be remembered?
Yeah.
I think that it will, hopefully, I mean, for a lot of people, it's going to be a very stressful situation, the people working in healthcare. And something that we noticed when we first started was that we didn't have all the even personal protective equipment that even in the healthcare, like the professionals, that we didn't have the N95 masks and that kind of stuff, for example. Like, so I think it'll be hopefully help us prepare for any future events like this and be more aware that these things can happen. Like we haven't really had this happen in the United States. So to have it happen worldwide like this has happened, I think is very eye-opening to hopefully to everybody, especially the administrative side of our hospital, that they're like, oh yeah, we need to make sure that we're stocked and we need to make sure that we've got everything present so that we can treat the patients, because the last thing you want are the healthcare providers becoming ill, because that takes away from so much of the care that we could provide.
Right. It definitely, it's a very interesting time. And I've taught nursing education for quite a while, and I think on how could I have prepared my students, and I'm not sure there's an answer to that.
Yeah. I'm not sure like what you could do to prepare them for a situation. It's just like you just got to be in the fire sometimes.
Exactly.
Yeah.
Exactly. Well, interesting. And so have you dealt with any employees who are afraid to come into work?
We actually had our not at my clinic necessarily, but we have satellite clinics in the surrounding Delta County, and we did have one that just said, the front office worker just said, no, I'm not coming in. I'm not chancing it. She has little kids and a new baby, and so she's like, I'm just not going to be there. So yeah, there is that fear and concern, and that's something that our clinic director said. He said, if you don't feel like you can be here, then just let me know. And I mean, that's understandable.
Right.
Yeah.
How about your patients? How are they responding?
I've had a few patients that just said, while this is going on, I'm just going to stay at home. I'm not even chancing it. Right. And I've had other patients that are like, I'm not afraid of it. It's not a big deal. It's going to pass. Those we have both sides of it. So, but like I said, my biggest concern are for those patients that have chronic pain and aren't reaching out and aren't communicating, but just I've had several patients that have just kind of disappeared, and you're like, oh, well, I wonder what happened with them, and I hope they're doing well. But yeah, and I've been on the phone with several of them, and some of them just say, yeah, I think I'm just going to wait and wait it out and that kind of stuff. And that's fine. But I mean, there's just both ends of the gamut of like one very cautionary and the others are just like still running around out there at the grocery stores without masks on and that kind of stuff. And you're just like, you got to take care of everybody, I think.
Right.
You got to watch out for others.
Yeah. So it's interesting you mentioned, with your new specialty with the chronic pain. I was reading somewhere, and I didn't read the whole article, but it talked about, we've been trying to get the opioid epidemic under control. We've been making some strides in that, but there's a fear now that it's going to increase again. Have you heard anything or have any thoughts on that?
I haven't heard about that. What their concern, can you describe, like, why do they think it's going to increase again?
Because the patients aren't maybe getting to the doctors, so they're going to be looking for things outside of maybe going to the doctors. And
Oh, right. So, right, that makes sense. So, yeah, if they can't get in to see their physicians and their physicians are like, well, I don't want to refill your script without seeing you or at least talking to you, that would make sense. Yeah, hopefully that doesn't happen, right? Hopefully there's not that recurrence.
Mhm.
Um, but like I said, I mean, when people have pain, they're gonna seek for ways to take control of that pain, and opioids aren't the answer, which is what we found out in medicine. But not everybody knows that, and if you've already got that opioid addiction, it's really you can't just kick it on your own. Like you
Right.
definitely need the help. So
Mhm.
yeah, I really hope that doesn't happen.
Right.
It's not.
Right. Well, I just see that I would really hope that somehow they could do some telehealth with physical therapy because I could see that working for you guys.
Oh
Get
yeah.
patients still moving in their home.
Right. Even before this started with the COVID-19, I think it would be a great, a great ability to have is to communicate with patients without having to have them come into the clinic. Because there's a lot of patients that are limited on their transportation or limited on, like, they have to pay for gas and that kind of stuff to be able to come in. And if mostly what physical therapy is education to the patient, it's really helping them to understand
Mhm.
you can do these things, but you can't do these things. And with therapeutic neuroscience education or that pain certification that I'm seeking, it's sitting down and talking and really communicating and helping people understand what pain is and how that can affect them and how they can in turn affect what they're feeling, um, that can be so successful.
Right.
So,
Absolutely. Well, I appreciate it. How about, do you have any other thoughts or reactions to this?
well, I'm glad that I live in a small area and no longer in the Denver area.
Yes.
I can imagine that it's been a little bit more crazy out there. Um, but there are two communities near us, Grand Junction and Montrose, that both have over 30, I think, cases. I think Montrose has about 50, and I think Grand Junction's at 30. But the challenges that are we just never know when this kind of thing's going to happen. Like there was no predicting this coming on, and so I think preparedness is the major thing that we need to look for. And on top of that, like I really feel like this has brought people, even though the social distancing thing, I really feel that people are becoming more empathetic and compassionate, and really seeking for ways to help others out, despite not being able to be close to them, but reaching out to maybe loved ones and that kind of stuff that they haven't maybe even spoken to for years. But having the technology that we do nowadays, just like we're communicating, I
Mhm.
mean, how great is that?
Right.
That we can see our family and converse with them, and feel close to them without having to be um, geographically close to them. So,
Absolutely.
yeah.
Absolutely. Yeah, very interesting. Well, I really appreciate you taking some time and talking to us about your experience with this. It means a lot, and um, I wish you the very best of luck
Thank you.
in
Thank you
staying
for
healthy.
interviewing me and, yeah, chatting with me. That was fun.
Yes.